Hi, I am Dr. Suparna Bhattacharya, infertility specialist, practicing infertility for the past 8 years. Currently, I am attached as a consultant at Motherhood Fertility, Kolkata. Endometriosis is a chronic progressive disorder of the reproductive age group found approximately in 5 to 10% of women of the reproductive age group, and which results in 30% of cases to 40% of cases in infertility. Usually we define endometriosis as the endometrial lining which is present inside the uterine cavity is found in places other than that, usually the abdominal parts, the ovaries, the fallopian tubes, rectum, and other also rarer sites. Usually what happens during this, as with each menstrual cycle, these ectopic endometrium, that means the endometrium away from the uterine cavity, these become responsive to hormonal changes. With the cyclical hormonal changes, this leads to bleeding in these sites, which lands up into cysts in the ovaries, adhesions, scarrings, and different kinds of symptoms the patient presents with. There are 3 factors which are involved. One is the pain of the patient, second is the volume of the disease, and third is infertility. The patient presents with different kinds of symptoms. Somebody with pain may present with severe pain or mild to moderate pain. Somebody present with irregular bleeding may bleed throughout the cycle or may have heavy bleeding. Somebody may pain during intercourse. Somebody may complain of painful micturition and defecation. Some with very vague symptoms like fatigue, tiredness, headache, nausea. So all these presentations are different for different patients. We have to manage each and every case as per the problem the patients are facing. When the patient comes to us with all these symptoms or all these complaints, the main thing we have to prioritize is what the patient wishes. Does the patient want pain relief, or does she want a confirmative diagnosis, or is she looking for a pregnancy? So to reach to a diagnosis, we have to exactly know how we are going to stage this. Ultrasonography is the preliminary test or investigation we do, which is helpful in advanced cases where we get cysts in the ovaries, but in case of early cases, it is not usually confirmative. Laparoscopy still remains the gold standard in staging the disease for therapeutic, where they remove the adhesions, and diagnostic with the removal of and surgical treatment for the patient. The laparoscopy is the gold standard. Once you stage the disease, you know how to progress and manage this case, or how you'll take up this case further. Regarding the treatment is as per the patient's wishes and what they actually want. Do they want pain relief for their treatment, or do they want a conception? If it is pain relief, we can put them on medicines or injections, or may take them up for surgery, maybe conservative surgery, and relieve them of their symptoms. In cases of patient wishing for pregnancy, we have to stage the disease and have to help them achieve their pregnancy following laparoscopy, because that's the gold standard and that will help you stage the disease, where you can advise them expectant or treatment, or you will put them through assisted reproductive techniques. In advanced cases, there is no scope for expected treatment. You have to put them through assisted techniques, especially IVF, because endometriosis is something in all the stages tends to disturb the oocyte quality. It disturbs the tubo-ovarian anatomy. It disturbs the implantation factor. It involves the uterine lining. So every factor is involved. So the earlier the person or the couple wish to get pregnant, I think they should get themselves a consultation with the infertility specialist to help them achieve pregnancy. Since it's a very important factor is this disease is a recurrent procedure. So once you have a surgery or a cyst removal, this tends to come back. So all recurrent endometriosis is also very, very common. So whatever we have to decide quickly as to how we are proceeding, and we give these couples a healthy pregnancy as quickly as possible.